Hyaluronic acid, or HA, is a large polymer of glycosaminoglycan chains. Due to its particular molecular bonding, HA creates a random coil structure in physiological solution that presents both hydrophilic and hydrophobic properties. HA is present in various parts of the body, for example in the cartilage, extracellular tissue, synovial fluid, and in the eye, where it has several important functions that can mainly be attributed to its water-binding ability. HA plays an important role in joint lubrication, cartilage elasticity, wound healing, and cell proliferation. It retains large quantities of water and therefore controls tissue hydration. Through its viscoelastic properties, HA protects tissue against overuse and shock. HA is produced in the joint by synoviocytes and is extruded into the synovial fluid. It confers the characteristic viscoelasticity to the synovial fluid, which is otherwise a simple plasma dialysate. In the joint, HA acts as a lubricant, shock absorber, and filter. Its average molecular weight is 3 to 4 million Daltons, and its concentration is 0.2 to 0.4% in normal synovial fluid. There is an HA layer covering the cartilage surface and synovial membrane. It protects the underlying tissues from damage caused by mechanical and inflammatory factors. It also masks the pain receptors. This results in pain-free and friction-free movements of the joint surfaces. Although arthroscopic procedures have been successfully used for many years, post-operative complications are often characterized by pain, effusion, and restriction of joint mobility, caused by the lack of physiological synovial fluid and absence of joint homeostasis. Viscoseal is the first post-arthroscopic synovial fluid replacement. It contains highly purified, non-chemically modified sodium hyaluronate, produced by fermentation. That is, it is devoid of animal proteins. It contains 10 milliliters of a 0.5% solution of HA, which is close to the concentration in normal synovial fluid. Viscoseal was introduced in 2001 and is distributed in more than 20 countries in Europe, Asia, and South America. Viscoseal is indicated post-operatively in all arthroscopic procedures to diminish pain, restore mobility, and joint homeostasis. A 10 or 20 milliliter syringe with an 18-gauge needle is used to aspirate Viscoseal from its sterile container. Once the irrigation fluid is evacuated, Viscoseal can be injected into the joint through any portal under arthroscopic control. The joint is then moved, which allows Viscoseal to distribute evenly throughout the joint, coating synovium and the joint surfaces. In a clinical study of 93 patients who underwent knee arthroscopy, those treated with Viscoseal had a significant decrease in pain compared with those who underwent the standard procedure alone. The improvement was significant 1 week after surgery, and this improvement was maintained until the end of the clinical study 1 month later. 58 patients underwent arthroscopic subacromial decompression. The early post-operative data showed that the Viscoseal group experienced less severe pain than the control group, 29% of patients who received Viscoseal were pain-free at 4 hours post-operatively, while all the patients in the control group felt pain. Viscoseal resulted in a reduction in analgesia consumption, as shown by the data from Anand and Funk. Viscoseal markedly reduced post-op knee effusion, for example in patients that underwent arthroscopic partial meniscectomy. In comparison to bupivacaine, Viscoseal showed a more rapid improvement in function, resulting in earlier discharge from hospital and faster recovery through earlier rehabilitation and an earlier return to work and daily activities. Dr. Mattis, which joints can be treated with Viscoseal?
All large and small joints can be treated with Viscoseal after arthroscopy. Clinical evidence exists for the use of Viscoseal for the knee and shoulder joints.
After which procedures can Viscoseal be used?
The following arthroscopic procedures can benefit from treatment with Viscoseal: in the knee, partial and total meniscectomies, ACL and PCL ligament repair, debridement and lavage in osteoarthritis, microfractures with marrow-stimulating procedures. All cartilage repair procedures can benefit from Viscoseal. In the shoulder, acromioplasty, shoulder stabilizing procedures, including rotator cuff repairs.
Are there any contraindications?
Viscoseal is contraindicated in case of joint infection and also in case the patient is allergic to any of the constituents of the product.
Can Viscoseal be used with a red-on drain?
Yes, Viscoseal can be used with a red-on drain. After administration of Viscoseal, the red-on drain should be clamped for 15 to 20 minutes and the joint moved. This is sufficient to coat the synovium and cartilage surface, as shown by the results of Mattis' study in 2006.
Can other products be injected simultaneously?
The postoperative installation of bupivacaine intra-articularly in combination with Viscoseal is well tolerated and has not resulted in any adverse events to date.
What are the side effects with Viscoseal?
Since the launch of the product in 2001, no adverse events related to the product have been reported.
Is there any literature concerning Viscoseal?
Several publications are available on the short and long-term effect of the use of Viscoseal. These studies suggest that treatment with Viscoseal will contribute to a rapid restoration of physiological joint conditions and homeostasis.
In conclusion, the use of Viscoseal post-arthroscopy is safe and effective in reducing post-operative pain and effusion, reducing NSAIDs consumption, improving function in patients recovering from arthroscopy, and restoring joint homeostasis. Consequently, Viscoseal contributes to an earlier discharge from hospital and an earlier return to normal activities, thereby reducing the economic impact.